Hello everyone, my name is Nelson Min and I'm a specialty course faculty for ASPIRE. Today I'm going to teach you a treatment for the lateral elbow using dry needling. Some controversy exists at the role of the brachioradialis in regards to elbow function. There's been debate on when is it the most active, during elbow flexion with supination, pronation, or neutral. Here's what we do know. Although it's listed as an elbow flexor, the brachioradialis actually shares innervation with the triceps, which of course extends the elbow via the radial nerve. In an article by Basmajian, he shows that the most active forces during EMG recordings are with fast extension of the elbow, consistent with chopping and throwing activities. He further confirmed the work of McConnell that shows the brachioradialis is more of a shunt stabilizing muscle for the elbow as opposed to a spurt muscle that produces force. In another study by Boland, they also showed that although the brachioradialis is active in elbow flexion, one of its highest recordings with EMG was with pronation. This suggests that the brachioradialis might work more in conjunction with the triceps in those high velocity power movements, as this is a functional set of the elbow, that the brachioradialis is more closely related to elbow function as an eccentric controller of terminal elbow extension. For your patients with lateral elbow pain after repeat or prolonged upper extremity activity, dry needling would be a great option. To find the brachioradialis, it attaches to the lateral aspect of the distal humerus, crosses the elbow joint down to the radiostyloid process. Have your patient go into full pronation. That way, when you go through the brachioradialis down to the radial head, you'll also get the supinator that lengthens as you go into full pronation. And the supinator is a dynamic sling for the radiohumeral complex. Finding the brachioradialis, compress and spread the tissue to find the radial head. Quickly tap. Advance the needle down to the periosteum of the proximal radius. Hold on to that needle to let the tissue settle so that when it recoils, it doesn't take the needle out of your target. The other needle we'll put on the proximal side of the elbow into the powerful extender, which is the triceps. I like going in the muscle belly, which will have the most concentrations of muscle spindles. With those two needles indwelling, you can now hook it up with electrical stim. That'll supply the triceps, brachioradialis, supinator, and the lateral elbow, all sharing a common innervation of the radial nerve. With this, you'll improve axonal transport and recruitment throughout the entire nerve. Once your technique is over, you should recheck to make sure elbow extension is restored. The most important step now is to reinforce this with strength and stability to change their motor plan. If you found this interesting and would like to learn more about ASPIRE dry needling or any of our ASPIRE core courses, please check out our website at ASPIREOMT.com for the course most convenient for you. Thank you.